This is after you come out of the OR and they get you hooked up to all the equipment, but you're still on, can you see that? You're still on the breathing tubes. So this obviously freaks out a lot of people. I remember having to see my father in breathing tubes and it was horrifying, but everything's sound and everything's okay, all right? So here's the other deal. I was freaked out that you'd wake up with these tubes in your throat and you'd be gasping and, anyway, that's not what happens. You go in, you're doped up, you don't know you have the damn things in there, and their goal is by the time you wake up, the breathing tubes are out. So I will just leave it at that and tell you not to worry about that part. So that's actually a good picture because they got you wired up to every control you can imagine and monitoring every body function. This is just one of many pictures of phenomenal staff helping out. I can't remember what this gentleman's doing here. This one, I'm grimacing a little bit. This is the nasty part. I'm not going to kid you. See those 3 tubes? Those are the drainage tubes that go right into your heart, and they go down to buckets, plastic pails on the ground, and they're about, 4, 5, 6 inches. They're in your belly, and they drain the fluids, and you feel the damn things. Somebody hits it by accident, it doesn't hurt, but you feel the thing wobble in your stomach. I will forewarn you, I mentioned about pain. Besides the pain in your chest and the sternum, which comes from the territory of cutting open your sternum, the one thing that did hurt, and I've been warned about it, is when they have to pull these tubes. Don't let anybody kid you differently, and they didn't. It hurts when they pull them out. So I would tell you, ask them to dope you up as much as they can. It will make it a lot less painful and stressful for you. The process when they pull these tubes, it's relatively quick. I don't know, whatever it is, 3, 4, 5, 6, 7, 8 seconds, but it feels like an alien's reaching in and pulling out your innards. Sorry, I just have to tell you that. And this was my joke. That's my plastic bag I brought to my surgery meeting. It says job name, my name. It says backup parts, valve job. There's a heart. There's a garden valve, a little roll of duct tape. That was just my way of kind of dealing with life. There I am again, ICU, after coming out of the operatory. This is the start of the process, the vascular clinics. And, heart and vascular clinics. You think you were going to a spa. But anyway, that's how it all started. There's my first meeting. And that's a slice away of the heart, and that's the arched aorta that's in there, and I guess that's the aortic valve. So that's that. Here I am. I'm a little foggy in this one, but this is in the prep room. So this is before you go into the operation. They have you come into a little prep area. They shave off all your hair, where they need to. They get you on an IV. They give you a sedative that helps calm you down, and it did because I don't really remember a whole lot, and I think I'm still there. There's the heart again. There's the heart again, and sorry if those are redundant pictures. There's one. How do you like that? That's the picture. Look at the big zzz. I'm still hooked up. And I was able to garner a second income out of this whole process. I was featured on the cover of Mummy magazine. Ha, ha, ha. That's what that looked like. And then the food was pretty good in the hospital. They ultimately gave you a menu. You could pick and order whatever you wanted. And I can't go on and on about how nice the staff was. That was my buddy Debbie, been there for a long time, helped me out quite a bit. I don't even want to begin to say names because there's so many that were helpful. This is Jeremy, but he's got a picture with the fart book. He jumped the furthest. He probably went about 4 feet back when I got him with the fart trick. So that was pretty good. And then we knew it was getting close to go home when I was sitting in the chair next to the bed, and my daughter and wife are lying in bed watching TV in my bed. I said, something's wrong with this picture. So it was the next morning that I was discharged. That was the end of that party. And here's my other buddy. I forgot her name, but she helped me out throughout the night one night. You pretty much get the same person for each shift. And then I told you I was up walking around. I think this is 2 days after I got home. I was walking up and down the street. And I'm not quite that fat. That's part of the bloat that I was talking about that kind of goes along with the deal here, and why you've got to have a scale and make sure your fluids are passing and all that kind of stuff. There's my wound healing up faster than you'd imagine after 3 or 4 days at home. It's happening. This is, sorry, you got to look at my man titties. These are the 3 incisions where those drainage tubes were. So they dress those up separately, and that oozing is perfectly okay. They want you to dress that for 3 or 4 days at home, and everything is healing very nicely. And what day is today? Today is Sunday the 25th. Last night on 3/24, mind you, I had the operation on the 14th of March, January, February, March, and you know, your sleep cycles are all screwed up. There I am in the supermarket with my daughter at midnight last night. We decided to go shopping for some nice fruits and vegetables, and I was able to get out of the car, use the the cart as my walker, and I got my exercise going through the supermarket. So how do you like that? Would you have guessed that? A week and a half after the operation, and there I am again smiling. And this, you know what? The staff is incredible. Everybody's incredible, but it's beyond words. This is Dr. Wu, who is the prestigious cardiac surgeon over at Stanford, who did my procedure, and I thank him for his efforts and as far as I'm concerned, my life, and his partner in crime, Dr. David Schofield, who assisted him and did a major part of the operation. And it may not mean anything to you, but I'm going to tell you, Dave is now the proud recipient of the less than 8-minute Hemi Arch move. It's a record. Congratulations, Dave, and I'm glad you were able to do my job. So it's those 2 doctors that pulled this off for me, and they're world-renowned surgeons. That's a picture of the chair that I was talking about. I absolutely would tell you to go get one, borrow one. I was fortunate enough to find a family member that had one that was sitting around, and we got it down to the house before I went into the hospital. But even if you've got to go buy one, I would tell you it's worth every penny of it, all right? So they're $600 to $1,200, and you can get them at any one of the medical stores. Made all the difference in the world. So now you have my story, and I hope it scares you a little bit. I hope it relieves a little bit of stress, and also helps give you a few pointers that sometimes are not in all these lists of things to do. And I tell you, unless you got something really wickedly weird going on, it'll all work out. Okay, the biggest battle is here, and that's before you go in, dealing with your family, and also when you wake up and dealing with the people at the hospital and your family. Keep this straight, and everything will work out well. Okay? So I'm on my road to recovery. I hope your operation goes well, and I hope this few minutes of my inside view helps you in some way. God bless.